Hello, my name is Wendy Resnick, and I'm a nurse practitioner, and I work in the field of psychiatry. I've been working in the field for 35 years, and I've been working with CurePSP as a trainer for people that are facilitators of support groups. I will be giving 2 webinars about the Group Leader Training Program, How to Facilitate Effective Support Groups. This is the first one. We call it Group Leader Training 101. So please be sure to watch both of them because they really come as a pair. To begin the first one, let us start with talking about the structure of the support group. There are certain stages of the group that will be true in any kind of support group. So the first stage is the introduction. It's very important that you give a clear introduction at the beginning of the meeting. And so if you have a co-facilitator, you should decide before the meeting who will do the introduction. One of you can do the introduction, one of you can do the summary, because you will also have a summary at the end. During the introduction, your name, your co-facilitator's name, if you have a co-facilitator, the time of the meetings, and the purpose of the group should be conveyed. Also, a statement about the guidelines, or several statements, which we will go into about the guidelines for the groups. So, hello, my name is, this group meets from 7 to 8:30 p.m. And the purpose of this group, which will be your purpose, is to share experiences related to living with CurePSP, with PSP or CBD or another MSA, whatever the group is for. So you will fill in that blank, and for caregivers. Or if your group is just for caregivers, obviously, you would say to share, the purpose of this group is to share experiences related to living as a caregiver. So if it's a joint group, you'd have both. And if it's a caregiver group or just a patient group, you'd have the one. You would fill in, of course, the types of brain diseases included, if it's MSA, if it's PSP, if it's CBD, if it's a combination, you would include that general statement. The important point here is that the purpose is to share experiences. It is not to give diagnoses. It is not necessarily to give any kind of advice. It isn't therapy. The purpose is simply to share experiences. Now, often that does include questions and answers about, well, what did you do? Or what has your experience been? Or what do you know about this? Or who did you go to find out a correct diagnosis, etc. But this is all based on experience. A speaker might come in who gives an expertise, who provides an expertise via a lecture. And sometimes your group will have a speaker. You might decide to have a speaker and then have the second part of the group be a discussion, a sharing session afterwards. So the purpose of the group is always to share experiences. If you do have a speaker, that is a separate component. And then you go back to the purpose of the group, and it's always defined. The next part of the introduction are your guidelines. Your guidelines are also very, very important, just as your purpose is very important, because it's like the purpose, again, to underline that, is like your guiding light. Your guidelines you're going to use to always go back to whenever there's a problem in the group. You're always going to go back to the guidelines. Those guidelines are going to give you really the ability to form the whole sense of safety for people in the group. And they are your boundaries. They give you a sense of this is what we do. As a facilitator, this is what I do, and this is what the members of the group, the participants of the group do. So it's very comforting to people when they go into a group situation or any situation, as you know, to feel like you know what's expected of you. You know what the guidelines are, you know what the purpose is, you know when the group or the situation begins and ends. In our case, it's our group. So see these guidelines and see this whole introduction actually as setting the stage for a successful group meeting. So the guidelines now are a statement, a couple statements that remind people about the standards or expectations of each person's behavior. And you don't need to say that. You can just say that we have a few guidelines for our group. And the first one is that we share experiences. Of course, this comes from your purpose. We share experiences versus giving advice. It can be stated that simply. And what that means, of course, is that we give suggestions. We offer personal experiences. Instead of saying, you should do this, we say, my experience has been, or this is what I did, or have you tried, or what do you think of this? Instead of saying to people, this is what you should do, this is what I did, so this is the right thing. Because of course, everybody's experience, even though everyone in the group is there for the same reason, there are still variations, as you know, in each of our experiences. So we never want to assume that we know exactly how someone feels or what is the right thing for them. So the second guideline, I'm just going to go down here, whoops, yep, to these guidelines for a moment. So I will go back to the other slide, but just to come down to the guidelines here for the group. The next one is sharing the air versus monopolizing. So the way that we can explain this is everyone who wishes to speak has an equal opportunity to do so. On any given night, you might have a different number of people in your group because these are open groups, and an open group meets on a regular basis, maybe once a month, maybe more frequently, on a particular day and time, and people can come and they can go as needed or as desired. So sharing the air is that everyone has a chance to speak. And on a given night, if you have 10 people, it's important in your hour-and-a-half time, and most of the groups will meet, and an hour-and-a-half is a good time, a good amount of time. Some will meet for more. If you're already meeting for 2 hours, for example, and that works for you, and you have a break in the middle of the group and that works for you, keep doing it. If you haven't started your group, an hour-and-a-half is a good amount of time for people. Research has shown that people can sit for that amount of time before losing their attention span. So that is a good amount of time without break. People can get through an hour-and-a-half, typically without having to take a break. And if they need to, they can always go out and come back in individually to visit the restroom, etc. But typically it's reasonable to expect people to be able to sit. So if you have a larger group, you can imagine that if 1 or 2 people were taking a lot of the time, it wouldn't give much time in that hour-and-a-half for everyone to have a chance. We just want to make sure that everybody has an equal opportunity to share. And that's just reminding people. Now you will use this guideline, just as you will use the previous one and all the others, if there is a participant or member who maybe starts to talk a little bit more than what you would hope or expect. And then you'll come back to the guideline, reminding the group, because you've already said it at the beginning. And you'll move the group on. We'll talk more about that, especially in the second training, 102 training webinar. For right now, we'll just go through them a little more briefly. The next one, the next guideline, is being supportive. We are a support group, you can say. So being supportive versus judgmental. Different people's opinions and points of view are important and welcome, but that is without judgment or criticism. Very important to remind people of that. And then a safe atmosphere for people to express feelings without negativity, without people feeling afraid, always feeling this is safe. We're all equal. It doesn't matter what culture, religion, ethnic, social, racial difference. We are all accepted here. And another thing that's important to say here is about confidentiality. Confidentiality is another guideline to add here. And that is, what is here, what is said here stays here. So it's very important to let people know that whatever we say, we know that we can trust, that we are safe here in this group. So those are your general guidelines, adding this one about the confidentiality. And what was said in the group stays in the group is certainly fine to do that. So this covers advice giving, helping, sharing. It covers non-judgmental behavior. It covers not being negative, being supportive to each other. And so the important points are covered. And then when you need to come back to these guidelines, you will do so. And I will illustrate how to do that. We're going to go back now to the first slide and go again into the go-round. So the go-round is the next phase after the introduction. After you've come in through the welcome and the purpose and the guidelines, then you go into introducing each person. So you can say, now we'll go into our introductions, having each person introduce themselves to the group. And to do this, I'd like to ask each person to say their name and what brought them to the group, particularly if this is your first group. So if it's not their first group, again, what brought them to the group is going to be very appropriate. You might be more specific to say, are you a caregiver? Are you a person with PSP? If you feel that you don't want to or some people, of course, won't be able to speak perhaps in the group, that it is perfectly fine and we understand to just pass. To just pass is perfectly fine. So each person goes around. You can illustrate. You can be the first one to do that go round. You can be the one to illustrate how people should do it. And if you have a co-facilitator wherever they're sitting in the group, which is of course a round circle, and they would be sitting across from you so you could see each other's verbal expressions and body language. And eye contact, you'd have eye contact with each other. So every person will go around and you're going to ask people to be brief. So this isn't the time to tell the story. This is the time just for the brief introduction, and you're going to ask people to just do that. Then you'll go from there into asking the group a question. So now that everybody has gone around in this go round with introductions, then you'll throw out a question. So what has transpired since the last meeting? Would anyone like to begin with any questions that they might have for the group, or anything that they have experienced that they would like to share with the group since the last meeting. If it's the first meeting, then the question, of course, is, would anyone like to begin to share what has been going on for them related to, of course, our purpose, which is living with these diseases. You can even be more specific with your question that you throw out to get your sharing experience started. You can ask, you can have topics that are kind of general topics that one of which you might throw out to start. And it isn't a topic that has to be continued through the whole meeting. It's simply just a topic question to ask. So it might be about family members. It might be about general care. It might be about holidays coming up, about the transition for people between the summertime and into the fall. It could be any of these things, about recent diagnoses. It could be a question about how difficult it is watching our loved ones, particularly if it's a caregiver group and it's more specific to caregivers as they continue on with the disease, progressing with the disease. It could be any of these topics, and you can think of them yourself. But it's open-ended, and it's not a yes or no question. The last part of the group, in terms of the stages, is going to be the summary. The summary is done in a go-round fashion. So about 10 minutes before the end of the group facilitator or co-facilitator, as it's been designated prior to the meeting by the facilitators who will do the introduction, who will do the summary, will say, we have about 10 minutes left of the meeting, or for the end of our time of the meeting. So I would like to suggest that each of us go around and say one thing. If we choose to talk, to speak, say one thing that has been helpful in the meeting tonight. So of course you're going to have to tailor this based on whether it's a patient group of people that maybe are unable to speak as much, or a caregiver group for people that can. So this may change. If it's a patient group and people aren't able to speak, you wouldn't be asking them to do that. Perhaps the summary would be a summary where you would summarize. But if you have the opportunity to use this, I really recommend you're trying it for closing the group meeting. So one thing that each of us has will take away that has been helpful to us this evening or this afternoon, depending on the time of the meeting. So I might say that one thing that was really helpful was to talk about, if it was my turn, say people were talking about family members and how helpful that was to hear how people talk to family members about that. Or one of the ideas that George had about how to greet people when they haven't seen my husband for a while, this kind of thing. So one thing that each of us, which is personal to each of us. And so what's wonderful about this kind of go-round for the summary is it empowers each individual in the group, because each person feels like they are important. They have something to say. Also, they're able to look back, each of us, through the hour and a half or so of the group and really look at what did I do during this time? What was important to me? It's also wonderful for people to get to know each other this way. So one person in the group will feel like, oh, I'd really like to talk to that person afterwards. Or they'll feel really good because they were acknowledged in something that so-and-so said was very helpful to me. It also empowers the group as a whole. The whole group feels we are a group. And this is a very important phenomenon because this is a mutual help support group. A mutual help support group is people helping each other. And it is defined by a helpee, someone who is maybe newly diagnosed or a new caregiver, helping and being helped by someone who has been there and been down the road for a while. But it works both ways, you see, because it isn't just the helper helping the helpee. It's also the helpee helping the helper. And that is the beauty of mutual help, because we help each other. Often, the person that is new to this process and this whole journey can be just as helpful to someone who's been down the road for a long time. That is empowering. It's empowering for the newer people, and it's empowering and equalizing for the whole group. And so it provides a sense of meaning for the group. It helps people learn about each other, as we said, as people go around. And it provides a sense of closure. And it's really very positive, because people are looking back on something they'll remember, something they'll take with them. And members want to come back. They feel a part of the group. This is their group. So you will hear me say, it is the group's group. It is not your group. And we want people to feel a part of it. And in that way, they make it a part of their lives. So let's go on to the next slide. The role of the facilitator is to encourage constructive interaction in the group. So when you don't need to speak, you don't need to speak. You are what we call a participant observer. You will participate just like everyone else in the group because you have something to share. You are most likely a caregiver, or at least perhaps someone who knows something about these diseases, but most people are caregivers. There are some of these groups where the person might be a professional person in the field facilitating a group for people with the diseases or for caregivers. So you will share as you would a member of the group if you are a peer person, a person who's experienced this themselves as a caregiver, or as a person. There are groups where patients who are very newly diagnosed might be facilitators. So you have to put yourself in this whole context and use it as it fits you. So as a participant observer, you speak and you share, but you also observe. And that is different than any other member of the group, because the other members or participants, I use those words interchangeably, they're not thinking about observing. You're observing the whole group. You're using active listening. You're watching people's behavior. You're listening to any issues that you might bring out as a question, or you might use skills, as we talk about a little later, to focus on something that was said. And so you're watching. You're always thinking about each individual of the group, but you're thinking of the group as a whole as well. How do people's behaviors affect the group? If someone is talking a lot, for example, how is it affecting everyone looking around? Are people starting to get antsy? Are they getting frustrated? Is this a little too much? Is it too much detail? Is anyone crying? Is anyone depressed? Do they look depressed? What are you noticing that you need to pay attention to? Is someone acting like they are an expert and they know everything? Is there anyone that isn't talking? And why are they not talking? Is it because they cannot? Or is it because they're afraid? Or is it because maybe they're nervous because it's their first time? You're noticing all these things so that you can make your mental notes and you can know what skills to use as you use your active listening You're also using your eye contact. You're looking at people, you're looking at everyone. And the whole time that you are in this group, you, as a facilitator, are scanning the room, looking at everyone. When one person is talking, you're looking toward others as well, instead of just maintaining a focus on one person. You're encouraging interaction that way. You're including everyone that way. So you come back to looking at one person, but you're always looking around to actively listen to the group as a whole. Each individual has an effect on the group as a whole. So you listen, you observe, and you feel the feeling tone of the group. So the second role of the facilitator is to manage problems or challenging behaviors that might come up in the group. And some of these we will go through many of them. Some of them are going to be more appropriate and you will find will happen in your group. And some will never happen. So we're going to focus on some particularly that will have maybe more of a tendency to happen in your group. We'll go through those and get to that. The role of the facilitator is not to prescribe medically, physically, or emotionally. For example, we go back to the purpose. Always go back to your purpose and your guidelines. We are not here to diagnose, and we're not here to prognosticate, to give a prognosis. We're not here to judge people's symptoms or to look at them physically and make any assessment or evaluation. We're not here to decide what level of grief someone is in or how they're dealing with this or whether they should be dealing with it differently. The beauty of these groups is that we are, going back to your purpose, just, and I say just in italics because it's a huge piece, to share experiences. When can you be in a situation sharing experiences with people without being judged, without being questioned, without being given advice, without being told what you should do, because people want to help so much that they will fall into the pattern. And we all can relate to this, particularly with family members or close people in our lives. We don't want to see them hurting. We don't want to see them suffering. So we jump in and we want to fix it. And that is perhaps the biggest vulnerability that we have, the greatest vulnerability that we have as facilitators, because we're doing the job, because clearly we have great compassion and we want to help so much, maybe sometimes too much. So we'll talk a little bit more about that, but it all goes back to your purpose. If you can stay on your purpose and see it as a guiding light, like a lighthouse that you on your little boat are going toward, you will always keep the group feeling, or help the group, I should say. You'll keep the group on its focus and on its purpose, and you'll help the group so that it is a wonderfully comfortable and physically and emotionally safe place to be. Encouraging sharing experiences and setting guidelines during the introduction to enforce them. Now, enforcing sounds like a pretty strong word, but enforcing means being very clear and being, very, very true to these guidelines, because the guidelines will become a safety net for people. They will feel more comfortable, just as we feel in any situation as adults, and certainly we see this with children. The more clear the guidelines are, the more clear the boundaries are, the more we don't test them. If you think of children, testing guidelines, testing boundaries, testing to see if the authoritative person in their world means what they say. Well, adults do similar things because we really are children too inside, and in a lot of ways we want to know, how is this going to work? Am I allowed to do this? And some of us have clearer sense of boundaries than others. Some of us in a group situation, particularly for this kind of group, your CurePSP and brain disease and CBD and MSA, these brain diseases in this kind of group, people are vulnerable. They're anxious. They could be feeling fearful, so many different emotions, so many things. So the clearer the guidelines are, the better for people. They will feel more comfortable, as we all do when we feel safe, when the guidelines or boundaries are clear to us. So setting these, again, in your introduction, you can have them written. They can be on a piece of paper that you will give people, but that doesn't take the place of verbalizing that. Even if the same people come each meeting, you still verbalize them. I really don't think you need to have them on a paper, as long as you verbalize them. The one thing that's nice about a paper, though, if you decide, and these are all these ifs, I'm giving you a formula, I'm giving you a recipe, and it will definitely work. But there's some times where you can tweak that formula recipe, just like we do when we're making a particular recipe ourselves. A little more salt, a little more pepper. Well, if you decide, yeah, I like the idea of the written guidelines. In fact, for a group that's been meeting for a long time, it can be a very nice touch to ask some of the other people if they would like to read one of the guidelines, and each person down the circle reads a guideline and explains it, so that you're not the only one. It becomes shared for everyone. Just a thought, just an idea. We will be talking about how you do enforce these guidelines as we keep going. Here they are again, adding, of course, the confidentiality statement, which really has to do with the fourth one, the safe atmosphere for expression of feelings, that everything that we say stays in the group. And that's really all that needs to be said for confidentiality. So we're going to be going into different problems and solutions. As you can see, there's a lot of them here. But I'd like to just explain before we go into them, because we're going to get into them more thoroughly in the next Facilitation 102 session or webinar, that you're always going to be using your purpose and guidelines to go back to whenever there's an issue. A group, when I say an issue, I mean a problem behavior, as we will talk about some of those behaviors. Let me bring one up right now. Say there are people that are in the group are getting into negativity, and negativity is an understandable thing. There's a lot to be upset and fearful about when you've been diagnosed with one of these diseases, PSP, CBD, MSA, any of them. And of course, that's to be understood and expected, and people should have the opportunity to talk about their fearful feelings, how they are feeling. However, many times negativity can come across in such a way that it starts to feel like there really is no hope coming across. So when that happens, I say it like this: your antenna goes up. Now, what I mean by that is that in your mind you say, you get that thought of, yeah, I think the process is being disturbed a little. The atmosphere is disturbed. It doesn't, I'm listening, and I need to say something. What is it that I can say? Sometimes I also feel that it comes in your gut first. Some of us have that thought first, that antenna goes up. Some of us feel it in our gut, in our belly. Some of us feel both. That is a sign to you that, okay, we're here to share experiences. You're thinking this yourself. And now we've gotten into this place where the sharing has gotten into a certain atmosphere of negativity. So one thing that you can do is you can gently interrupt. You can wait till the end of a sentence, and you can say, excuse me, or I'm sorry to interrupt, but however you feel that it's most appropriate and feels comfortable for you. This is me talking in quotes as an example, it's understandable that we feel, and the people here and all of us, if you were also in the same boat, you can say we, will feel hopeless at times and fearful at times. And that it's important that we can talk about these feelings in this group. I would like to, though, now get us back on the track of solution, of how to, of what we have to be hopeful for, of what we can do. Now, you can ask a specific question here. Maybe it's related to something that someone had been talking about, or you can ask a general question here. So basically, the skill you're using here is called refocusing. It's when the group strays to a place that either is inappropriate, perhaps a little bit irrelevant, maybe in this case, maybe just too much of, of the negativity. And you as the facilitator are refocusing the conversation. Let's say it was a topic. You would say, I'm sorry I've allowed the group to stray from our topic. Let's refocus on PSP. Or let's refocus on whatever it was that we were talking about, and it might have been family and how they respond to, or caregivers, or how to find the best care we can, or some of the issues that we are facing. If it's a caregiver group, when people die, when the group gets smaller, how does that feel? Let's talk about that. Let's let that be okay. This is a safe place. So you see, you can help the group go in and out of more superficial to more deep emotional content. The group will always start superficially so the superficial things are going to be questions and answers about specific care, or diagnosis, or prognosis, or symptoms, those kinds of things. And when you have a mixed group of patients and caregivers, it's going to naturally be more superficial, because caregivers are not going to feel comfortable talking about their deepest fears, nor will the patients in front of the caregivers, and vice versa. So there is a definite benefit to separating. It can be, I know that there are some groups in CurePSP groups that will meet together and then separate, and some that just have separate meetings, and that all of those are good. But if you want to be able to go to a deeper emotional content, it will just naturally be more appropriate and happen more easily, clearly, with separate groups. So the facilitator is always thinking of both the individual and the group as a whole. As we said before, you are a participant observer. Trust your instincts. I cannot underline that one enough, because trusting your instincts means that when you feel, when your antenna goes up, or when your belly or gut, you have a gut reaction to something, feel, be intuitive, trust how you feel, trust that the way you say something is going to be fine. It's going to come out fine. The way you say it, it's going to be much better than the way I say it, because you are the one that knows how it feels. And you are coming from a place of compassion, a place of empathy, a place of having had the experience. So trust your instincts. And as you trust your instincts, what happens, the beauty of a mutual help group, is that you are a member just like everyone else. You're not an expert. You don't know more than anyone else, even if you've been down the road longer. Everyone has an equal amount to share and give. The beauty of that is that there is a certain equality and a certain sense of trust that people will have in each other. And as you trust your instincts, they will feel that ripple effect of being able to trust their own. Let's talk about boundaries and your boundaries, your issue of what you feel you're responsible for. We've already said that the two roles of the facilitator are one, to encourage effective interaction, and two, to manage challenging or problem behaviors as they come up. Otherwise, you are a participant like everyone else, and you're observing to see if there are any ways you can encourage interaction. For example, if there is someone who is very quiet during a meeting, and you feel you would like to invite them to participate, and you're clear that they're quiet not because they can't talk, but because maybe they're new, maybe they're just a little more quiet, a little more introverted on the introverted extroverted continuum. Maybe they're not sure what to say. You always have the ability, and I'd recommend you do this, to use a skill that we call gatekeeping. And it's just called gatekeeping because you open the gate and you let the person in. And it's just called that in the literature. What it means is that you will say to them at some point in the group, if you've noticed they haven't had a chance to kind of find their way in to the discussion, you're going to be looking at that person and others that maybe haven't had a way in to ask if they'd like to participate, to invite them in. So maybe it's a specific directed question that you could say, would you like to share on this? Or what has been your experience with this? If you know their name, you would say their name. If you don't, you just use your eye contact and your physical gesturing with an arm or with a physical movement in the direction that they're sitting. And you would invite them in to participate. A person can always say, no, I'd rather not. Of course, you would only ask the question if you knew they were capable of speaking. If it was clearly a person that could not, then you obviously would not. But you will know that because you will have had your go-round. So you'll already know about people's ability to speak. So the person can always say, no, but thank you very much. And then you can say, we are just glad you're here. Very powerful statement. Notice that I use the pronoun we, not I. And the reason I do that is because when I am speaking from personal experience, I use I. So we always use I statements in the group. My experience has been, I have had this happen, right? But when we're talking about the group as a whole, because we are the facilitators, so we can say, we feel. That is a very cohesive word. That is a wonderful word, we. When you're not talking about your own personal experience, but when you as a facilitator, co-facilitator, I'm meaning both, because you're equal. If you have another facilitator, both are equal, your peers, both of you to each other. Then you can say we to include everyone. And the beauty of that is that just by saying that, you are communicating to the group that we are one. We are a whole. And everything that you as a facilitator say and do should convey that. When you're not speaking from your personal experience as a participant and you're not observing, anything that you might say that where you can remind people that we are a group, we care about each other. You know, we are a whole, you know, and that is a beautiful thing. So back to your sense of responsibility and your boundaries. The group, it is the group's group. It is not your group. You are not there to do anything but encourage a constructive environment where people can share experiences. That's it. So then we come to ourselves. We are like, okay, so how, when I start feeling like I want to fix or I want to make it better, or it requires a lot of self-awareness on our parts, you know, or when I want to give the answer as advice, you need to be very, very aware that what we're here to do is to not change people. We're not here to fix people. We're not here to make their grief better. We can't do any of that anyway. So if we could, we would, but we can't. So because we can't, we must go back to the purpose of the group, which is sharing experiences. And what that does is it gives the group a chance to do the magic, to perform the magic, and the magic is within the process of the group, within sharing experiences, just as we have constructed a recipe. So stay out of the way and don't talk more than anybody else. I'm giving advice. Don't talk more than anybody else in the group. Make sure that I like to use that as my guideline. It's sort of like a yardstick. If I'm speaking more than other people, than anyone else in the group, I'm speaking too much as a facilitator. So it's a really good way to measure the amount, the quantity that you speak. I would also like to say with this responsibility issue that the reason I think it's so important, and I'm underlying it, taking some time with it, is because it's natural and normal for us to want to help so much, that we want to move things along when we see someone depressed, or we see someone in a stage of grief that we've gone through. But we must respect that, and respect the process, and respect each person's road and path. Their grief process and journey is their own. And we know ourselves that when we feel we have the space to move through our lives without being given advice, in a safe environment where people aren't stepping into our space and trying to do something for us, where we can feel empowered to take the responsibility ourselves of taking care of ourselves, that we're much more successful and effective in the long term. So that is the gift that you give. That is the gift that you give as a facilitator to the members, to the participants. And honestly, it is very liberating to the facilitator to know, oh, you mean all I have to do is help the group stay on its purpose, to share experiences. I can do that. So we end up carving boundaries around us and helping people by respecting their own, by valuing, honoring, and respecting their boundaries and our own. So I would like to thank everyone and give you a sense of what we're going to be doing in the next PowerPoint presentation or webinar presentation. We're going to be going through facilitating the fundamentals, how to deal with problem behaviors. And we're going to be talking about managing all of those behaviors. And there were quite a few, as you saw, as we went through those slides quickly. How to redirect the individual, how to redirect the group when a problem behavior comes up, and if you need to, how to do it on a one-to-one basis. So we're going to be taking all the different behaviors, which here are some of them, and issues, and we're going to be going through each of these, as well as a few others. And we're going to be talking about how to redirect. We're going to be talking about the facilitation skills. We've talked about a few of them. We're going to go through all of them. And end with the challenging behaviors, which we will have mostly talked about, but just do that as a summary. So I would like to go back through the slides and tell you as a summary what we just talked about, since I can't ask you something that was helpful to you. I'm going to have to be the one to do it. But if it was a real support group, I would really suggest you do this summary as we talked about. We talked about the introduction. We talked about the components of the introduction. The welcome. Always start on time and end on time. Within 5 minutes, no more than that. Even if not everyone's there, you start on time, to respect the people's time. You will find that if you do not start on time, people will start coming late. So do start on time. People will, again, this is a boundary. This is an important way of respecting other people. The purpose, to share experiences, living with, fill in the blank for your group. The guidelines of sharing the air, the guidelines of what is here stays here, the confidentiality, the guideline of advice. We don't give advice, we give suggestion instead. We use I language by sharing experience. We're all equal, we don't judge each other. So these are the different guidelines that we talked about. The go-round, how to start the go-round, how to imitate, to be the one to initiate it so that you can show people very briefly, we're going to introduce ourselves and say what brought us to the group. Sharing experiences, starting that part with after the go-round. Now we're going to get into discussion, to sharing. We'll be, instead of giving advice, you can even say again, we'll be sharing experiences, which is the purpose of our group. You'll ask a question, either to the group, and again, let the group respond, give them a silence so they can respond, or you'll ask someone to begin. I recommend sharing a general question or a topic question, or asking people what has transpired between any situations they like to discuss between our last group meeting and this one, if it's not your first meeting. Then we talked about the summary. We talked about the wonderful way that you can do your summary, where you can ask each person to go around, which encourages cooperation among all the group members, involving the whole group. Using about 10 minutes before the end of the group meeting, using this approach, you'll ask people to go around and say one thing that was helpful to them in the group tonight or today. We then talked about the role of the facilitator. We talked a little bit about what that means. We talked about not prescribing, about just the purpose. Here are the guidelines again. And we will be going into these problem and solutions in the groups for the next webinar. We then talked about some of the points that are fundamentals of facilitation. And we ended with trusting your instincts and being very clear about honoring, respecting, and valuing your boundaries and others by focusing purely on sharing experiences and providing a safe way, a safe environment for people to do so. I'd like to thank all of you for listening to this webinar, and I hope very much to meet each of you at some point as I continue my work with CurePSP. Thank you very much.